One of the most common questions that I got asked is if it's possible to combine procedures, and the answer is certainly yes. The reasons are many. I would say, first of all, that it is possible to combine procedures when the procedures are applied to the same body surface side. For example, we can operate on the breast and on the abdomen together, or on the face and the breast together. And the reason is that the recovery position after a frontal plastic surgery would be on the back, so sleeping on your back. Certainly, there are other aspects to consider, like for example, proportions. And sometimes the indication of a combining procedure become a bit stronger independently from the patient wish, so it becomes more a recommendation from my side rather than a request from a patient. Like for example, I just finished consulting a patient that inquired for face and neck lifting because obviously she had an advanced skin laxity with collapse of the cheeks, of the jowls, and obvious skin excess on the neck. So we're talking about all the details about the plain face and neck lifting, and it became obvious as I was lifting the face higher up and the soft tissue where they're supposed to be, how the upper lip was not necessarily changing in any of its current proportion, but as we lift the face, the upper lip was looking longer and longer. And at that point, it became obvious to both of us how if we proceed with the face and neck lifting, we should also optimize the length of the upper lip, which was by far too long otherwise. Probably the most common combination of procedures that I perform are, for example, today, the lower blepharoplasty along mid-face lifting. And the reason is that I do not perceive how you could operate properly on the lower eyelids without lifting, at least partially, the this is called malar fat pad, so moving these higher up. That's because on one side you'll get a better support of the lower eyelid if the fat pad is higher up, but also you'll have a much better and longer lasting correction of the tear throw effect. Another very common procedure that I perform together is a BBL, which by definition is a combined procedure because we're using the Vaser and the power-assisted liposuction instruments to reduce the fat whenever the patient wishes. The most common is the 360. Liposuction and fat injection, probably in my practice, is the most common combined procedure I perform. Main advantages in proceeding with the multiple surgeries together certainly is optimization of patient's time, and in many cases, I mentioned earlier on, is optimization of the outcome because the recovery is a single one. Obviously, when you perform combined procedures, in particular when they are more extensive in terms of body surface area, like for example 20-30% of the body surface area when you operate on the tummy and on the breast at the same time, then obviously patients need to be assessed from the medical point of view very carefully. So we need to make sure that the full blood count is alright, the liver function, the kidney function, the coagulation, all the parameters need to be spot on. Or otherwise, certainly we can try to restore them before they're back in range, or otherwise we may simply decide to proceed in separate stages and, as usual, stay on the safe side.